How does deutetrabenazine Austedo work? Have you ever wondered how certain medications can help with movement disorders? Today, we will discuss deutetrabenazine, also known by its brand name Austedo, and how it works in the context of schizophrenia symptoms and movement disorders. Deutetrabenazine is primarily used to treat movement disorders like Huntington's disease and Tardive dyskinesia. While it is not specifically designed for schizophrenia, understanding its mechanism can help us see how it might relate to movement issues in schizophrenia. So, how does deutetrabenazine actually work? It inhibits a protein called vesicular monoamine transporter 2. This protein is responsible for transporting neurotransmitters such as dopamine, serotonin, norepinephrine, and histamine into synaptic vesicles in nerve terminals. By blocking this protein, deutetrabenazine reduces the amount of these neurotransmitters released into the synaptic cleft, which is the space between two neurons. This reduction can help manage excessive movements and other symptoms associated with movement disorders. In conditions like Huntington's disease and Tardive dyskinesia, there is often an imbalance of neurotransmitters, leading to involuntary movements. Deutetrabenazine helps stabilize these movements by lowering the releases of dopamine and other neurotransmitters that are involved in motor control. Now, let's talk about how this relates to schizophrenia. Schizophrenia involves complex changes in neurotransmitter systems, especially dopamine. The main issue in schizophrenia is often linked to an increase in presynaptic dopamine releases in certain areas of the brain. While deutetrabenazine is not used to treat schizophrenia directly, its effects on neurotransmitter releases can be relevant. For individuals with schizophrenia who develop movement disorders like Tardive dyskinesia due to antipsychotic medications, deutetrabenazine can be a helpful treatment option. It manages involuntary movements without directly affecting the underlying psychosis. However, it is important to monitor for potential side effects, such as mood changes or an increased risk of depression, especially in patients with a history of mood disorders. In summary, deutetrabenazine works by inhibiting the vesicular monoamine transporter 2, reducing neurotransmitter releases, and helping to manage movement disorders. While it is not a direct treatment for schizophrenia, it can be beneficial for those experiencing movement issues related to their treatment.